Hi there, Dr. Khaled Mankel from Barrhaven Family Chiropractic here in Ottawa, Canada. I want to talk to you today about a very problematic condition of the spine called scoliosis. Scoliosis affects 2 to 3% of the population today. It's defined as a sideward deviation of the spine where the angle rotates more than 10 degrees. That is by its definition. It affects 2 to 3% of adolescents today. The most common type of scoliosis is called idiopathic scoliosis. And affects many kids, mainly in girls as opposed to boys, but it does happen in boys. And I wanted to speak to you and parents out there because the success of the treatments really depends on when it's detected, because this condition, believe it or not, is not symptomatic at all in the early stages. It can be found in young infants as well as early adolescents. And so you just have to find out what type of scoliosis it is and get the right treatment as early as possible. But for most parents, the first sign that you're going to see is maybe your child's back from the side and they may have this rib humping process or an unleveling of their shoulder. So early detection is the best, and so we recommend that kids, boys and girls, get checked as early as possible. The Scoliosis Research Society has come up with a recent paper that told us that the best form of treatment above 15-20 degrees is a brace. A brace is kind of worn like on their teeth for braces, but it's made for their spine. And the new technology today is using computer-aided technology to mirror image the spine deformity. So if somebody has a shift to the left, we're going to make a brace that would actually put them in the opposite posture for a period of time and to allow the neuroplasticity of the tissues to change. The success of the treatment is only as effective as the technology of the brace. And being a doctor that focuses on neurostructural correction, we see a number of these cases being referred to the office because of the work that we do with neurostructural correction and scoliosis work. And I want to let parents know that not all braces are the same. Not everyone needs a brace as well. That just has to be diagnosed and see to what level they require care for. But I wanted to be able to let moms know that when you're inquiring about if your kid does require a brace, that a brace should be made in the mirror image because it is a three-dimensional disorder. So here's an example of a brace that was made for a young girl who was 11. And so she has the moderate degree of curvature of the spine, and because she's in her growing years, her risk for progression is very high. So what we have made for her is a brace from Scoliosis, which uses computer-aided technology to mirror image the distortion. So you can see, looking at her front brace, that her deformity, she has a rib and a shift to her left-hand side. So this brace was made to mirror image and bring the spine back over what we call an overcorrection, to bring that spine, as it settles in without the brace, back to as close to center as possible. You cannot brace someone in this distortion in the same configuration and expect a great outcome. So we want to let parents know that the success of that process is the success of the brace production. And sometimes when you end up going to surgery for scoliosis, which is very radical, some are required, especially if the curves are above 1650 degrees. But if we catch them early enough with the right brace, we can prevent a lot of them from going to surgery. So if this is afflicting your child and the brace that you have is not being successful, then I urge you to at least consider the Scoli brace as a different option for you, maybe a better option for you. You can get more information from our website at barrhavenfamilychiropractic.com. and I'm more than happy to send more information to you. But again, important to realize the success is only dependent upon the success of the brace if that's required. So I hope that was helpful for you, because I know a lot of parents are concerned, which they should be, because this condition does cause some debilitating problems as they get older. So the earlier the correction, the better the change. So any questions, please let me know. I'm Dr. Manko from Barrhaven Family Chiropractic.